Dr. I would like us to quickly talk about the state of health in Meru County.
Yes.
Now, from that perspective of being a surgeon, what is your comment on the state of health in Meru, and maybe most probably in Kenya?
Absolutely. So I will start in Kenya and then, zoom in on Meru.
Yeah.
In Kenya, the state is that we need more.
Okay.
Once I have that opening bracket, I can always break it down into small things.
Yes.
We need more infrastructure. We need more human resource. We need more manufacturing.
Yes.
We need more in terms of system efficiency. So health sector per se in the entire country requires a lot.
Okay.
Requires a lot in terms of human resource, in terms of infrastructure, in terms of capacity building, all that.
Yes.
Granted, with the devolution, a little confusion came along the way, so we left a lot of the human resource and infrastructure to the devolved system, and then the policy to the national level, and of course the national referral hospitals to the national level.
Yes.
My stand, which is on peer-reviewed publications and great literature and media over, is that my stand and the stand of so many of our colleagues is that the human resources for health, talking about doctors, nurses, clinical officers, nutritionists, name them, should have remained under a central body. That way we could distribute resources equally across the country in terms of human resource, and then we can do the others from the county level. But we devolved that, and there was a little confusion here and there.
Yes.
And with pockets of competing interests between health and other sectors, then you realize that health does not get the punching weight it desires.
Yes.
Health is a service. When health is a service, it is not romantic and enticing. We are in an electoral period, for instance.
Yes.
Every elected official who is campaigning now would want to show a huge building they have set up. But that might not be tangible if they are telling you, we streamlined the hiring of health officers or doctors, or we promoted so many doctors, or the efficiency or the turnaround of patients in this hospital moved from this number of hours to this number of hours, because it's not tangible and might not be sensational to the public. So that becomes where the health sector is hit, consistently hit. Now let me address myself to the human resources for surgical workforce. Recently we spoke, I published an article with my colleague Dr. Mwachiro, where we said out of the district hospital, the old district hospitals, which are now level 4 hospitals, only 2 out of every 10 level 4 hospitals have a surgeon. This is a Ministry of Health sanctioned study that found that. And when we look at Kenya as a population, we have a global assessment that says for every 100,000 people, you need 20 surgeons. Guess how many we have as a country?
How many do you have?
2.3 per 100,000 population, which means there is need to train. So I did not want to zero in on the county, because this is true in Meru County, this is true in Laikipia, this is true in Tharaka. Is the purchasing power. The purchasing power of health. By way of health insurance. This is what our people have as a problem at the moment. Majority of them, if you look around, maybe 90 to 95% will be funded by the national insurer. If you look at how much the national insurer is funding, the insurance model is premised on a working public system where there is nothing to cater for salaries for health workers. What is given is probably for consumables or something like that. But if you still have to look at that package for private hospitals or faith-based hospitals that still have to use whatever they generate to run their payroll and their human resource, you see that funding needs a little injection. This is from the provider side of view. From the consumer side of view, we still have a critical mass of Kenyans who do not have insurance. And some of them, if you have an accident today, you are stuck in the hospital, you don't have insurance. How do you get a life-saving surgery? How do you get the medication you need? How do you get to clear your bills and get back to your productive
What do you think is the
activity?
solution to that?
Now the solution is multiple-pronged. I have worked in the private sector more than I have worked in the public sector. But I've always said the public sector cannot abdicate the responsibility of health. The private sector only exists to support the public sector. So if the public sector quickly comes up at par and provides all the services, and all the sub-district, sub-county hospitals are funded resourced, equipped,
Yes.
and staffed,
Yes.
you see that kind of gives more breathing space to the faith-based and the private hospitals which are supporting the first bit. The second bit is to find a way to offer insurance to as many Kenyans as possible.
Okay.
If Kenyans are not insured, however, even you and I,
Yes.
if we don't have insurance and we are hit by an emergency, we will find ourselves spending our food budget on healthcare, which is wrong.
Okay.
Which is wrong.
Yes.
So two way to say is to train, equip, staff, facilities. I am talking about the public because
Yes.
the private is usually
Yeah,
a business
yeah,
model.
yeah, sure.
The public is where the government has a social contract theory with
Yes.
with a social contract with the electorally. If that is done, we will solve a lot of the problem. The second bit is if we can ensure Kenyans have an insurance.
Okay.
Whichever way, those who are not able, let them get a social protection.
Yeah.
Those who are able, let them have insurance. That way we will address majority of the problems we
Yes.
have. We won't conquer all of them,
Yeah.
but we'll have addressed majority of them.
Yeah.
Yes.
Yeah, Daktari, they say a healthy society is a society that is able to work and be able to deliver. Now, we have seen the mushrooming of private hospitals in Meru County, especially. What is your comment on this? Or are we saying that Meru, the Meru people are suffering and maybe the state of health is poor or something? What are we saying?
Everyone has got their own perspective, and if I have to address that, perhaps
Yes.
I will address it as a lay person, not as an expert in economy or business
Yes.
or something like that. But one thing I will think is the business drivers who are driving the private hospitals have seen an opportunity. They have seen a market.
Okay.
Now that market can be on several fronts. It can be on the population vis-a-vis the hospital coverage, that is
Okay.
one.
Okay.
Number two, it can be on the efficiency of the existing facilities, so someone wants to come and plug a gap. And these are theories I'm floating there.
Yeah.
It can be on the purchasing power,
Okay.
because there is also that perspective that Meru as a people do not have a problem with purchasing healthcare.
Okay.
So if you go there, they don't have a problem with purchasing, because there is somewhere else you might set a facility and no one is willing to pay
Yeah.
premium.
Yeah,
They
sure.
just want to go to the district hospital, for instance. So there are all those permutations, and everyone has got their own model on what they are chasing and what they are chasing. For me, I think Kenya is a capitalist society, so
Okay.
it's free business as long as it's regulated according to the authorities that be, and it meets the regulation and the ethics of practice.
Yeah.
If you are selling something that is above your competitors,
Yes.
you will have clients.
Yes.
If you are selling something that is the same as your competitors, then you have to differentiate it in a way that people will troop to you.
Yes.
If you are selling it at the same level as your competitors and all of you have clients, well and good, it means the market is not saturated.
Okay.
So I see it as a good opportunity, and also
Yes.
as an opportunity to give our clients or the patients, second, third, fourth opinion.
Okay.
When they don't agree with Aroyaro, they can go to Godfrey.
Yes.
They don't agree to Godfrey, they can go to another person,
Yes.
and they are all within reach. They don't have to travel to Nairobi.
Okay.
Yes.
A quick one on the issue of cancer. We have seen the menace that cancer is causing in our society, and especially Meru County. What do you think is the lasting solution to this, Dr.
Lasting solution to cancer, if anyone under lasting solution, it will be a groundbreaking Nobel Prize kind of invention where you know what causes the cancer and you give people vaccines about cancer. That would be the ideal.
Yes.
We don't have that because we don't know what causes cancer. Only a few cancers are known, this is the cause. Otherwise, what we say is there are several risk factors or several things that can play to make someone develop cancer.
Yes.
But let me come to the burden of cancer. What you've observed is correct.
Yes.
It's not just in Meru. It is in various other facilities, in various other counties and corners of the country,
Yes.
and actually maybe even in the region. Now what happens is, if we discuss it and start giving opinion, we might advance an opinion that applies in one region and is different from the other. And the opinion is usually on two ways. One, either the real prevalence of cancer is rising, or people are going to hospital more and being discovered, instead of being told, oh, he was bewitched and he was found dead, it is found he had cancer. So you see, that is the narrative.
Yeah.
The point, irrespective of which narrative to push,
Yes.
the point is,
Yeah.
what determines conquer over cancer for any society, be it in Meru, be it in Nairobi, be it in America, be it in the UK, is at what point the cancer is discovered.
Okay.
If it is discovered in what we call stage 1 and stage 2, it is easy to cure.
Okay.
If you are getting it in stage 3, it's difficult.
Okay.
You will try, but the success rate will be low. If you're finding it in stage 4, it is incurable.
Are you suggesting that people should get screened more?
Absolutely. Now the thing is, people should get screened for cancer.
Yeah.
Now you can tell everyone walk through the supermarket and get a screening.
Yes.
We look at people who have met the screening criteria. For instance, if you have family history of a certain cancer, say if you have family history of breast cancer, then we know when you get 40, start getting screened.
Okay.
If you have family history of this other cancer, when you visit your doctor, tell them, my father had this cancer. They will give you a specific direction on get screening for cancer. What is screening for cancer is a list of tests and physical examination by the doctor that can be done every year or every twice a year.
Yes.
Now that might be music to the ears of people who are struggling to make ends meet. But the one thing that every single day I struggle with and I feel frustrated about is when someone has labored with pain, discomfort for months to years, and then they come and they are discovered to have advanced cancer.
Okay.
Why? Because they went over the counter and they said, I feel I have some heartburn, and they are told take yogurt or take maziwa mala or take this tablet. So my call would be, if someone has some discomfort, because your body is supposed to be normal, but the moment you're feeling I'm not myself, I am weak, I can't walk, I'm feeling uncomfortable, get a doctor's opinion. And if the doctor treats you and within a week that is not going, get another opinion.